Today, I'm very happy to have Dr. Sanam here today with us, a naturopathic doctor, and we're going to be talking all about eczema. So we know that eczema is an umbrella term for many very similar skin conditions, right? So that can be atopic dermatitis. There's nummular eczema, seborrheic dermatitis, right? So it's usually often referred to as atopic dermatitis, though, which is a chronic condition. It affects children, it affects adults. Really, everybody can be affected by eczema, and it is characterized by dry, red, itchy, and flaky skin. And it's actually associated with a lot of other conditions, which we'll get into. But it can be associated obviously with your immune system, digestion, different areas of health. So today we're going to be talking about, a naturopathic approach to addressing eczema, as well as many of the factors that can be associated with it, and how that's done, whether there's different changes, looking at dietary changes or lifestyle changes. And so that's why we're going to be talking to Dr. Sanam here. So I'm Dr. Danielle O'Connor. I'm also a naturopathic doctor, and I will be your host today. So welcome, and we're very happy to have you here. Please tell us a little bit about your practice, where you're located at. And I know you have a virtual practice too. So yeah, a little bit of an introduction there.
Yeah, sure. So I'm Dr. Sanam. I'm a naturopathic doctor, and I'm primarily located out of like Cambridge and Kitchener, so in the Kitchener and Waterloo area. So I do have like a physical practice here. It's at a Sage Naturopath clinic, and there's two locations, so one in Kitchener and one in Cambridge. And then to serve patients virtually across Ontario, I have my own practice called Easy Care, and that's a fully virtual practice, and that way it allows me to help patients throughout the entire province, but also here locally in the KWC area.
Nice. Great. So it's great that you have multiple locations so people can find you easily one way or the other, right? So fantastic. Okay, let's get right into it. So we're talking about eczema. We're going to really start off with what are the factors that do contribute to eczema? Because I know a lot of patients will come in, they have eczema, they've kind of been told this is what it is. Maybe they've had it since they were a child, or maybe it's new to them. So it's a matter of, I think a lot of people have eczema, but they don't really know why they have it and, where it's kind of starting from. So if you can maybe start with some of those factors, that would be great.
Yeah, sure. So eczema can affect children, teenagers, and adults. And oftentimes, at like a very early age, it's part of like the atopic triad. So allergies, asthma, and what's the third one?
The eczema.
Allergies, asthma, atopic dermatitis. That's right. So it's a three, right? That can really affect children. But that doesn't mean you can't get it as you get older. So as a teenager and as an adult, you can also get it. And what makes this condition complicated is that it is very multifactorial. So there are lifestyle changes or lifestyle, like a poor lifestyle can impact the prevalence of eczema and the severity of it. So for example, if someone isn't sleeping that well, you're not really giving your immune system a good chance to actually prevent it, but also address it. If you're not eating well, you're not eating your fruits and vegetables, not drinking enough water, same thing. The skin barrier will probably get compromised in one way or another. And it's just another cause that is associated with it. But then there's also environmental factors. So for example, if your occupation requires you to work with a lot of chemicals, there's also a greater chance of developing skin irritation and eventually eczema. But also the soaps that we use at home, whether or not our water is hard water or soft water, if we use a shower head filter, all these different things can impact the actual chances of getting eczema, but also the severity of it.
Right. And I think that's probably where it can get a little frustrating for people, right? Because I'm sure, patients are coming in, they're saying, I have eczema. I've changed, you know, I've taken out all of the soaps, or I've changed my laundry detergent and, you know, done this and that, but it's a matter of really pinpointing, you know, what the underlying cause is. And I would say, as naturopaths, we really do have a lot of great tools to help people figure that out, right? Because it can be difficult to really try and figure that out on your own.
Yeah, absolutely. It's and that's why we as naturopaths we take like a very thorough intake, really getting into the health history, past medical history, all the lifestyle, like all the different lifestyle factors that can affect eczema and other skin conditions. But then also diet, exercise, sleep, stress. And the reason we ask all these questions is because all these things essentially can impact and influence symptoms and diseases. So if we're able to ask all these questions and get like a broad, thorough understanding of the patient's concerns and the conditions that they have, then we're able to address each of these things individually and create a very comprehensive treatment plan that's individualized, but also very thorough. And that
Right.
gives the best chance of actually addressing a skin concern like eczema, which again is very multifactorial.
Right, right. So when a patient does come in, or like obviously you've seen a lot of people with eczema, would you say a lot of them, is it associated with like diet? Is it associated with like that stress and sleep piece? Like what do you see most often, would you say, in your practice?
Right. So I guess like the bread and butter of how I treat is we really focus on lifestyle and environmental changes first. And then we see like how much of an impact does that make? And if sometimes for some people, like that's all it takes. So for example, if someone's only sleeping like 5 hours a night and we can get them to sleep 7.5 to 9 hours a night, but good quality, refreshing sleep, sometimes that's it. That's the solution. And their skin conditions, or like eczema or acne or other things can improve quite significantly. But then there's also trickier cases that require a bit more. So for those people, for those patients, it requires some dietary modifications, sometimes some supplements, like vitamin D, probiotics, different types of healthy oils, omega-3 oils, but also omega-6 oils can also be beneficial in those tricky cases.
Yeah, absolutely. So yeah, I guess that almost segues into like the naturopathic treatments. So I know you've kind of mentioned a few of them already, but you know, what are really a lot of the typical naturopathic treatments? Are there a number of them that you usually rely on? Maybe go a little bit deeper into those too.
Yeah, sure. So why don't we start with diet first? Only because there is some research supporting some of these strategies that I'll be discussing. So, for example, eating more fruits and vegetables on a daily basis can significantly decrease the chances of eczema, but also improve symptoms. And that's something that we've known for quite a while. Drinking enough water is another thing. Hydration status is really going to impact eczema because it is your skin being compromised or the skin barrier being compromised. And one of the things that our skin and most of our body really likes is water, good, clean water, right? And then the next part of it would be healthy oils. So flaxseed oil, for example, has some good research behind it for itchiness, redness, and skin hydration. So not specifically eczema, but some of the different characteristics of eczema. And it can be used therapeutically as a tool. And I've seen many of my patients start feeling significantly better and their skin looking significantly better from some of these basic strategies. One thing I didn't mention going back to diet was refined sugar and other inflammatory foods. These can also make it a lot worse if it's already there. I don't necessarily know, and I don't think any of us can really answer this, but like we don't really know if eating poorly will get someone to develop eczema. But what we do know is eating better can oftentimes improve symptoms if there already is eczema.
Yeah, absolutely. Absolutely. And I liked how like you're really focusing on like lifestyle, right? And how whether it can be like changing your diet or even bringing in some of these oils. So you're like talking about like flax oil. And so it's not even something that you always have to rely on, like in terms of like taking a supplement, but you can get like flax seeds and incorporate that into your diet, right?
Yeah.
So yeah, there's some good tips and tricks there. Is that something that you often do, or do you usually rely on supplements?
I try my best to rely on foods
Mhm.
because it is our lifestyle that's really going to dictate the future of our health and well-being, right? Taking supplements is fine if that's what the patient prefers, but we usually aim for dietary and lifestyle changes. So, like you said, 1 or 2 tablespoons actually of flaxseed, ground flaxseed, in whether it's like in a smoothie or a yogurt or oatmeal or something like that can be very beneficial. But if
Mhm.
a patient prefers supplements or they prefer an oil, because for some people it just might be easier to take, we recommend about a teaspoon twice a day. But
Right.
flaxseed oil is only one type of oil that can be beneficial, right? There's borage oil, evening primrose oil. Then there's other supplements too, like vitamin D and many different probiotics that can also help out a lot.
Right, right. And that's really where that individualized plan comes in, right? Because, based on what the factors are, like what's causing it. Obviously, each person is going to have an individualized plan for their need, right? Eczema, as we know, isn't all the same across the board. So yeah, it's great to know. And then with these, lifestyle changes, supplement changes, like all of the things that you're suggesting, how long does it usually take to see results? Like, it's skin, right? So is it fast? Does it take a long time? What do you typically see?
That's a really good question. So skin is very it's very unique. Everyone's skin is very, very different. And we're all individuals as is. So the same like two recommendations given to two different patients may work very, very different. And the amount of time it takes to see results will also vary. But
Mhm.
generally from my practice, what I've seen is within a couple of weeks, we start to notice a change, a positive change. And after about a month or month and a half, it's usually a fairly significant change.
Mhm.
However, there are always outliers. So some people are just very resistant, or their bodies just may be very resistant to some of these treatments. And then in those cases, sometimes we have to just dive a little bit deeper to see if there's anything else that might be compromising, like the road to improvement in their symptoms.
Mhm. Yeah, absolutely. Okay. And then, I mean, typically I know, like, for my patients that come in, oftentimes for eczema, as naturopaths, we may be like the last resort. Like, they've gone to their medical doctors, they're given different creams to take. There's different types of treatment and conventional therapy that people will often try first. Now, is that something that you're able to work with? Like, if somebody is already doing a conventional treatment, can you still do naturopathic treatment in conjunction, or is it one after the other? How do you typically work with that?
So that's a good question. I ideally like what I like to tell my patients is let's just take the best of both worlds. Let's
Mhm.
take the lifestyle modifications, the environmental changes, the supplements, all that fun stuff, but let's also use the conventional medicine if it helps, right? So for example, with eczema, if it gets pretty severe, the patients are usually given a corticosteroid. And oftentimes when there's a flare-up, these corticosteroids are magical. They can really bring down the level of inflammation, the itchiness and the redness and so on. So I don't ever want to stop my patients from using conventional treatments because I think it's about integration, about collaborative care, and part of holistic care is using every option that's out there, and then specifically catering it to the patient's needs. But sometimes patients are a bit hesitant with corticosteroids because they may have heard something on TikTok or on the news or something like that. And in those cases, there are other topicals that we can also recommend as naturopaths.
Mhm.
So for example, this is something that I've been using a lot recently is like baby care products. Baby care
Mhm.
eczema products tend to work very well for the skin, even on adults. And that's because oftentimes these baby care products tend to have many less chemicals in them, fragrances, scents, and so on. So they tend to be a lot more gentle, but they still have a lot of good stuff, like colloidal oatmeal and other cooling agents that can really help inflame skin. And this is more so from like pharmacy side, or you can purchase it from like the pharmacy, Walmart, and so on. But then more so from like the natural side and from health food stores, there are calendula creams, vitamin E creams, many different things that have also been shown to be very helpful. So the approach we try to take is address the inside, but also help from the outside too, right?
Yeah, absolutely. And you know what? I think that's a great tip. I think I love how you said a lot of the baby products can be really beneficial because a lot of times people think that just because a product is natural, that it's going to be beneficial, but a lot of the natural products can have a lot of ingredients that can also be irritating for the skin, right? So it doesn't necessarily mean that it's good for that person's skin. So yeah, I like that, because baby products usually have like fewer ingredients, are more clean, more
Right.
natural, that type of thing. So yeah,
Mhm.
that's a great tip. That's wonderful. Perfect. So I think in terms of, eczema, you've given us a good outline of really what are the contributing factors, just knowing that treatment wise, it's not only about, using a cream on your skin, but really about looking at like your lifestyle and things that need to be changed in terms of, how things that you can do that can really help with the eczema and help kind of take it to the next level in terms of treatment. I know we've spoken about results and like how long it takes, because sometimes, it's not necessarily a quick fix, right? Like eczema can take a while. As as a naturopath, you're determining, what the underlying causes are. So people have to hang in there for a little bit as treatment progresses. And then also, about combining treatments. So you went over that. So a lot of great information. Anything else that you kind of want to add in there? Any other tips or, things that people should be looking out for in terms of if they do have eczema? Any last thoughts?
That's a good one. I do have a couple things I'd like to share. One being, don't give up.
Mhm.
If even if you try something, it doesn't work, that doesn't mean that your eczema is permanent. It's going to be there forever, and there's nothing that's going to improve it. Give it some time. Try different things out, and this is like where the skill of like a naturopathic doctor comes in, because I know, like for myself and for most of us, we usually tell our patients like that it does take time, and we usually have like a list of different things that we would like to try, but we want to go in order. We don't want to give too many things at once or at the same time, because if something does work, we're not going to know what it is. But at the same time, this way it creates some hope for the patient too. So just because one thing doesn't work, it doesn't mean the next thing won't, right? So it's important to always remember that there are many options, and it's important to try many of these options too. And then the
Yeah.
next thing I wanted to mention was just another tip. It's I oftentimes find that patients that wear looser fitting clothing, more natural clothing, so like cotton clothing and clothing that doesn't like cause irritation, itchiness, tend to see a quicker recovery in their eczema than patients that don't.
Great. Yeah, it's great information. Wonderful. Well, thank you so much. We're so happy that you joined us today for this call. Hopefully we'll have you out again. Maybe we'll talk about, more skin health or, different topics. But yeah, thank you so much for being here, and hope everybody has a wonderful day. We'll talk soon. All of your information, contact information is up on Health Buddha. So if anybody would like to speak with Dr. Sanam, then they can get a hold of you, and and you can take care of their eczema needs, right? So wonderful.
Perfect.
Okay, thank
Yeah, thanks
you.
for having me on. I really do appreciate it.
Okay, take care. Bye-bye.
Bye.